Here anatomy. This is chapter 7. This is the last portion. This is joints and joint movements. Here we go. Joints are also called articulations. It's a synonym for them. It goes into the main thing here is the classifications. So there's a functional classification and a structural classification. The functional classification is right here. This is based on how much movement are allowed at different types of joints. So they're either immovable, a synarthrosis, slightly movable is an amphiarthrosis, or freely movable is a diarthrosis. And then that's the functional classification. The structural classification is what material makes the joint. So they're either fibrous, and those are the ones that are immovable, or cartilaginous, those are the ones that are slightly movable, or they're synovial, those are the ones that are freely movable, and those are the joints that we typically think of when we talk about joints. So again, fibrous are held together by dense connective tissue. The sutures of the skull that we just looked at are an example, the major example of those. And then also a joint between the distal tibia and fibula. So that's down there near the ankle. Cartilaginous joints are held together by cartilage, either hyaline or fibrocartilage. The intervertebral discs that exist between each of the vertebrae are examples of these cartilaginous joints, and also the symphysis pubis, where the two pubic bones meet in the front of the pelvis. Synovial joints are joints that are freely movable, and they include a joint capsule in their structure. Joint capsule is a double-layer membrane that has synovial fluid on the inside. And again, these are the joints that we typically think of when we talk about knees and elbows. You can see there the different layers of tissue. There's a fibrous capsule that surrounds the entire joint that runs continuous with the periosteum of the bones that meet at the joint. Articular cartilage is the cartilage that we've talked about that covers the end of the bone, and then inside of there is the joint cavity that's filled with the synovial fluid that acts as a lubricant and shock absorption. A meniscus, you may have heard of a meniscus. Some joints, like your knee, have shock absorbing pads of fibrocartilage, and that's what the meniscus is. And also some joints, like your knee, have bursa that are fluid filled sacs. If you've ever heard of bursitis, that's when those things become inflamed and cause pain. Here is a nice look of the knee, and you can see several of the bursa listed. There's the meniscus in the front and in the rear. All the different types of joints. We have ball and socket joints, like the shoulders and the hips, allows a wide range of motion, but sort of the drawback is those joints tend to have less stability. So you have like dislocations that are common with shoulders. Condylar or ellipsoidal joints are similar to ball and socket, but a little bit less range of motion. An example is the joint between a metacarpal and a phalange. So that's like right here at your knuckle. You've got movement not just straight back and forth, but you can go in two planes. Plane or gliding joints occur where the surfaces slide past each other, and these are typically the joints of the wrist and how the bones in the wrist can slide past each other to allow for movement. That's the example we usually go with there. Hinge joint allows movement in one plane, so it's uniaxial, only in one direction. The elbow, the knee, all the phalanges joints between the finger bones. A pivot joint is a joint that allows for rotation. The atlas axis joint between C1 and C2 that allows for the head to move around is the best example. Also, the proximal end of the radius and ulna, that's what allows us to rotate our wrist back and forth. A saddle joint forms where articulating surfaces have both concave and convex areas. This one is the metacarpal of the thumb. The joint between the trapezium and the metacarpal of the thumb, so that would be right in here, right in here, where the thumb comes into the wrist. All right, picture examples of all that. There's the table 7.4 that summarizes all that. And then we get into the movements that happen with these joints. So a muscle contracts and it pulls on the bones. It's spread across a joint and it's connected to two different bones. The bone that moves when the muscle contracts, that's called the insertion point, and then the one that's stationary is the origin. So for example, if I contract my biceps muscle, it's connected down here to the radius, but also up here at the top to the humerus, and it decreases this angle. So this is the insertion, this is the origin. It moves it closer to it. Flexion is when the angle decreases, just like I did with my elbow there. Extension is the opposite, the angle increases. Dorsiflexion is moving the top of your foot closer to your shin. So this would be like picking your foot up off of the gas pedal. Plantar flexion would be the opposite motion, pushing down on the gas, standing up on your tippy toes. Hyperextension is moving a joint beyond the anatomical position. So anatomical position is very specific. Any extension beyond that. So it's easy. Anatomical position, the wrist is straight. So if I go to this, that's hyperextension of the wrist. This is extension. This is flexion. Abduction is to move away from the midline. Abduct, like a child abduction, means to take the child away. If you hear that in the news, it helps me remember what that means, because adduction with a D is the opposite, so to bring it back to the midline. Lateral flexion is bending the head, neck, or trunk to the side. You can see the pictures there. Rotation is moving around an axis, so that's like the head. We can rotate. Circumduction is taking apart and moving it in a circle, so that would be like doing, again, head circles. There we go. Pronation is putting the palm where it's facing down. Supination is facing up. So I can remember those two by up. Supination, up. Eversion is turning the sole of the foot outward. So it'd be like walking on the side where your pinky toe is. Inversion would be turning it inward, which would be, or excuse me, I'm saying that wrong. Eversion would be turning it outwards. So that'd be like walking on your big toe. Inversion would be on your pinky toe. Retraction is to move a part back, so like to give myself a double chin is to retract my head. Protraction is moving a part forward, so if I stick it out forward that way, you can do that with your jaw as well. Elevation is to raise a part. I can elevate my shoulders. Depression is to lower a part. And that's it. Go Knights!